from downtown LA.
What's up?
This wonderful apartment.
It is.
Thank you guys.
It's a beautiful day in the summertime.
People watching to the tree.
Yeah. Yep. All right. So today we're going to talk about terms, words, terminology. Oh, your microphone. Definitions, medical jargon that we're all very familiar with, and maybe some of our listeners are not as familiar. And it can help clear up any kind of confusion or questions. I know that I had a long introduction to all of these terms because I got diagnosed young, but then sort of had a good 10-year span of just learning everything and immersing and asking questions. And I think that people definitely, one of the things that I never shied away from was asking questions like, wait, what does that mean? I think sometimes people get a little deer in the headlights. That's why one tip was always said to me that I think is absolutely very important, is it's very helpful to bring someone else, another set of ears with you to appointments, because sometimes you do get deer in the headlights as the patient, and it's hard to know what things are. So I had a lot of people also asking in my appointments, what does that mean? What does that stand for? What are you talking about?
Yeah, that's a good tip.
Yeah, it's just,
Yeah, because
you can't retain everything.
yeah,
Or you might hear something that you're interpreting that maybe wasn't really reality.
because your mind's like racing when you
Yeah.
go into these appointments.
Right. So, for purposes of today, we're going to be doctors and nurses and teachers.
Yes.
But
But
disclaimer, we are not doctors.
We do not have medical degrees.
Right.
None of us. Our only expertise lies in the fact that we have all been patients.
Experience.
And what we're speaking from is-
personal experience.
Yeah, it's from our experience. And
Yes. Every patient is different.
Right.
You should always consult with your doctor
Yes.
and always clear any kind of confusion with a medical person.
Yes.
Yeah.
Very much so.
Yes.
When I first got sick, my family doctor told me or advised me before he handed me off to the oncologist, specialist in cancer, to write all the medications and all the terminology and all this stuff down, and I was so scared, like I didn't do none of that.
I didn't either.
Yeah.
Yeah.
But you had way more time to gather down this information. Like I primarily just learned all the immediate basic stuff, like, and this is all like, 7th grade biology stuff that
Yeah.
I never knew. I mean, I made a
But you had a crash course in it.
right, and then I became very familiar with
Right.
white blood cells, red blood cells, platelets, and
Exactly.
the basics.
Yes.
And what they
Yes.
do, and then chemo, and then
Yeah.
the different names of chemo and types of chemo, and then
Yeah.
and then it stems off from there. Like there's so many different terminologies and verbiage that they use in the hospital,
Right.
in the hospital world, in the cancer world. It's just it's almost like a whole another language.
It is another language.
Yeah.
Medical language is another language.
Yeah. And
Yeah.
for me, I'm being reintroduced to a lot of these terms.
Yeah.
I remember hearing a lot of them when I was in the hospital. But like how we were just chatting about, and what we were talking about, like a bone marrow biopsy, or
Right.
I didn't know how they actually extracted it. So knowing that,
Right.
now I feel even worse that my mom went.
Yeah.
Well, yeah. I
But-
mean, yeah. It's interesting how the three of us experienced all of this because we all came at it in very different ways. I mean, Brandon, you were a kid, so you know the terms, you've heard them. Maybe you haven't thought of them in a long time, or You have it. You didn't quite know exactly what it was, but
Right.
it's registering because you've heard it.
Mm-hmm.
I had a long time to just, I mean, talk about don't go on WebMD. You know, like I did a lot of that.
That's what Alex did.
Yeah, but I had, at City of Hope, they give you actually a binder, a bone marrow transplant preparation binder, which I read through. I read through when I first got diagnosed, and then kind of put it away because it was too overwhelming, and I knew it wasn't gonna happen for a while. And then right before transplant, I read through it again and really studied it. I don't know if it was. I think it was good that I did because I felt it gave me, whether it was a false sense of preparedness, it gave me sort of a feel of oh, okay, I know what this is, and I'm reminding myself. And then Alex, you had to not only emotionally deal with everything in a very short time span, but you had to also learn everything in a very short time span.
It was one day. The day they told me I was diagnosed, that I had cancer, was the day it all started.
So that's probably how most people, I feel like that's how probably a lot of people receive the information, right? I mean, it's sort of one day. I mean,
Yeah.
So
you learn as you go.
Yeah.
So did you do anything that first day? Do you remember doing anything specific? Did you go home and Google, AML?
I remember you Googled the red dots.
Yeah,
The
I
petechiae,
Googled the
red dots on-
symptoms
yeah.
as I was experiencing symptoms, but I never Googled
leukemia.
specifically Yeah,
leukemia or that kind of stuff at
Interesting.
first. Because when the day I got diagnosed, you just it's too overwhelming.
Right.
You're looking at all the initial lab results, and they're
Right.
explaining to you how you have cancer,
Right.
and how they have to admit you immediately and put a PICC line in you right away and do a biopsy that same day, and then chemo the next day. You don't really have time to process. And then you're
Nothing
thinking,
to process.
you're thinking about should I get a second opinion, or
Right.
are they is this some kind of conspiracy? All these kind of
Yeah.
ideas,
Crazy ideas.
and
Yeah.
I didn't have time to
Wow.
go Google this stuff. I just believed my.
I don't think there was Google when I was diagnosed.
Yeah, exactly.
I had to find an encyclopedia.
Yeah.
Right? It's so.
They didn't have that.
it's so
That's
different,
so
yeah.
crazy. That's really
You didn't
funny
even get to
think
take
about.
any pictures when you're
I
in the
know.
hospital.
No
There's no
photo,
proof.
There's no,
No-
yeah,
There's no
yeah.
proof.
Did you really go through this? No, just kidding. Interesting. Well, petechiae, for those who are listening, petechiae is a condition or a symptom of a lot of blood cancers where you
Red
get
dots.
these red dots on your skin, and it's really blood vessels breaking.
Right. Mm-hmm.
And that shows up on your skin. So it's little pin dots of red on your skin. I would get it if I scratched my arm, not hard, just scratched it like I had an itch. All of a sudden, I'd have a whole breakout.
Because you're breaking the capillaries.
Because I'm breaking it,
Yeah.
and my platelets were so low.
Mhm.
So that's what petechiae is.
Yeah, I remember I was bumping a volleyball around with my friend's kids.
Yeah. I
Like
did
a
that too.
month before I
And
was
your
diagnosed, and
arms.
my arm was just completely
Bruised.
covered in dark red dots, like heavy.
Yeah,
Did you
Yeah.
did you start with bruises
I did.
first?
Yeah.
Yep.
Yeah, because I had bruises on my knee, and I don't know how they got there.
Right.
I don't remember banging my knee.
Yeah.
They were just huge.
Yeah.
I mean, I did have a basketball tournament a week or two before, all my symptoms started to show up. But yeah, there were huge bruises, and then the petechiae came after that.
Oh,
I had a
interesting.
fever, and then the petechiae,
Huh.
and then we just thought that it was some kind of rash.
Yeah.
Because that's what it looks like.
It kind of looks like a rash.
Yeah.
It's not raised though.
Right.
Mine was never
Yeah.
raised.
Right.
No, it was never raised.
And
Yeah.
it wasn't all over my body. It was
No,
just on my
it's in
arm
a
at first.
concentrated area
Yeah.
sometimes. Yeah.
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 Huh.
Well, and you were 13, so you don't think immediately.
Right.
No,
You
I don't
just
think
think.
you think at all.
No.
Yeah.
Yeah. I guess. Yeah. You're right.
I don't-
Whenever. Although mine, because I was not in sports. I mean, I was 25. When it was really severe. the bruising. And my brother was the one who was like, that's not normal, you know? So, like, there was the sort of like, something's wrong because you shouldn't have bruises. Like, I mean, they were covering my body. Covering.
Yeah, no, that's a tall tale sign.
Yeah. So I think, as opposed to if I was 13, it's like, well, you're playing, you're running, you could be, you know, fall down,
I just played in a basketball tournament, so
right.
You know.
Yeah.
Could have just bumped knees and just not realized.
Well, okay, so what if, here's my thoughts for those listeners and people wanting to get more information of how we broke it down. I feel like, what do you guys think was the easiest things to understand first? And then we can get into like more complicated terminology. So for me, I would say the blood cells. Like what is that?
Yeah.
So do you guys want to talk? I'll be the questioner person, and you guys can answer.
So Alex and I were both diagnosed with AML, acute myeloid, right?
Yep.
So acute refers to symptoms happening quickly and they worsen quickly.
Yes.
But over time it kind of slows down. So our cancer, our leukemia, was pretty aggressive when we were first diagnosed, or when we first found out, you know, our symptoms. So when I went into the hospital, they didn't say like acute myeloid, whatever. They just said that you have some funky white cells that are taking over your body.
Right.
Did they say immature?
Immature was a big word. Yeah.
What did you guys know at the time what white cells did for your body?
No, I didn't.
Okay.
I just knew that blood cells, red blood cells, pretty much you
Oxygen.
needed blood cells to live.
Right.
Pretty much.
Yeah. So whites are your infection fighters. For the most part.
They're your defenders.
They're
your fighters.
And if you have a seriously elevated number of them, and there are ranges, so for people who are wondering, like, well, how do you know? Obviously, it's a simple blood test, and it's called a CBC, which is a complete blood count. And it tests your white cells, your red cells, your hemoglobin, your platelets, along with a bunch of others, but those are the kind of the four main lines. And each cell line has a range, a normal range. And so if you are outside that range, that's when doctors are looking at, like, what's going on here.
To give the example, Alex, what was your...
The normal white blood cell count range is 6 to 10,000, and I was at 217,000 when I was diagnosed.
Yeah, so that's a red flag indicator.
That's pretty much, doctors will know immediately that it's some form of leukemia. Especially with elevated white cells in that kind of range. Do you remember what your counts were? Because it was so long ago.
Yeah, I
bet your mom would. We'll get your mom to.
I gotta ask my mom. I know she has like a box of things that she kept.
I guarantee you were somewhere like where Alex was. I'm sure it was very high, very high. So with my disease, myelodysplastic syndrome, and myelo, you'll hear myelo a lot because myelo actually means blood. I found that out. I asked one of my doctors. And so myelodysplastic is basically bone marrow failure. So all of my cell lines were very low.
Because they weren't being produced? Because
they wasn't getting produced, or it was all immature cells. They weren't fully formed before they were getting released out into my body. And so, like, my red cells, which red is oxygen carriers, my hemoglobin, which is, it's correlated to your red cells. It's a protein, but it carries oxygen as well. And then my whites were all very low, along with my platelets. The platelets were the lowest because and that was explaining why I was bruising so badly, which I'm sure you guys had low platelets. With the bruising. Normal range is, I think for platelets, it's between 150 to 400,000, I think. And mine at time of diagnosis, mine was at 30,000. at time of diagnosis or at time of transplant, my platelets were at 11,000.
Oh wow.
Wow.
So what you risk at that point is spontaneous hemorrhaging, like you could bleed you could bleed on your brain.
Very
you know,
dangerous, yes.
very dangerous. Like you could knock your head gently against the wall and have a massive.
No,
Yeah, 'cause
I
platelets are the-
I actually have met people who had family who had cases of exactly that, blood hemorrhaging from
Yeah.
this type of blood disorder, and by the time they went to the hospital, it was too late.
Yeah.
Yep.
Yeah. So it can be very dangerous.
Yes.
So.
Yes.
That's what doctors are really looking at is the ranges, the normal ranges versus what your actual CBC looks like. So platelets are your blood clotters.
Blood clotters, yeah, they help.
They help clot blood, and that's why they gather when you have a bruise. That's a bunch of platelets gathering together to stop the bleeding. White cells we covered, red cells we covered, hemoglobin we covered. So those are terms that people will hear a lot when
the basic.
dealing with any kind of blood cancer. We also have something that I did not know about, but until transplant. But one of the things that seemed to sort of take over was neutrophils. Did you guys remember talking about neutrophils? You definitely. But do you remember hearing the term?
I think
neutrophil?
I remember hearing about it. It wasn't talked about a lot.
So neutrophil is kind of like so the way I understood it, hemoglobin to red cells is like neutrophil to white cells, and neutrophil is as well your infection fighter. And they talk about your ANC, which is
I remember that.
yeah, your augmented neutrophil. I can't remember what the C stands for. I'll look it up. But do you want to look it up? Google ANC. But that's the level at which you have to get to. There's a certain level you have to get to before you can actually
absolute
neutrophil count. So that count is what they're looking at after you have your transplant in order to see if your donor cells are taking. And if your bone marrow is producing enough immunity, right, to protect you to go outside of your room, essentially.
Yeah, and I think I could be wrong, but I think I remember getting boost shots
Yes.
of that
Yes.
to help boost.
They give
the
you
immune system.
neutrophil shots.
Yeah.
Well, I think it's called Neupogen.
Yep. Is that the one they give you through your stomach?
I don't remember where I got mine, actually.
I remember getting Neupogen.
But it makes you kind of achy because it forces production of
Yeah, I
your
remember
neutrophil.
after my transplant getting those boosts, my joints would hurt.
Yeah.
It was like growing pains almost.
Yeah.
They would hurt so bad.
Yeah. So that's something that I think most people who deal with blood cancers, they're going to start hearing that term a lot, especially if you go through treatment of any kind of transplant. So that was a new definition to me. I didn't understand what that meant. What about, okay, so do you guys, here's one that you guys can talk about. So bone marrow biopsy versus spinal tap. So Alex, you should describe bone marrow biopsy, and then Brandon, you can describe
Spinal tap.
spinal tap.
Okay.
Because
Yeah.
they're two different things, people.
Yep.
Yeah.
Bone marrow biopsy. Brandon's never had one, right?
I
bet you did.
He's not
but
sure.
He doesn't remember. That's okay.
I would have remembered the way you guys were describing that. I would have
Yeah.
remembered
That's
that.
true. That's
For
true.
sure.
Yeah.
But bone marrow biopsy is basically where they need to go into your big bone, which is I forget what the big bone in your leg is, but the femur,
Or your hip bone.
the hip bone,
Yeah.
and then they go in there, and then you have a lot of stem cells and marrow that's stored in the middle of this bone, and this is where your stem cells are, with the cells, the production cells, the stem cells that produce the white blood cells, the red blood cells, and the platelets, and all the other cells. So when you have a blood cancer, a certain type of blood cancer, like I did, acute myeloid leukemia, Brandon, it's the it's the stem cells that are producing these cancer cells, and then that's where the cancer is identified. So they need to do these bone marrow biopsies to go into your big bone to draw out, the blood that's produced by these stem cells, and then they can identify the cancer, basically.
And they can analyze it, test it, and see what's going on in the actual marrow.
Yep. But this marrow, this biopsy process, where they draw the blood from, that's basically where all of the blood in your body is produced.
Yes.
Like millions and millions of new cells every single day. And how the process works is they go from the backside of your hip, right at your lower back and your hip, and then they take like this long needle that's kind of shaped like a straw, because they need to have it hollow, because they penetrate through, let's just say, the first layer of your bone. They penetrate through it and then get into the middle where all the blood or the juice is, and then they suck out the blood, basically. And then in the process, they also carve out a piece of the bone, which they need to bring back to the laboratory and test along with the blood. And that's basically what an aspiration is, a bone marrow aspiration or a bone marrow biopsy. And for me, we had to do this like every month or every month and a half, because they just needed to continue, because I was getting chemo at the same time every month. So after every chemo, they would have to go back, either before or after the chemo, they would have to go back into my marrow to test the blood to see if the cancer is there.
Right. Because what it'll tell the doctors mostly is the amount of cancer
They
is in there.
The objective was to see if I was still in remission.
Correct.
So remission, for those of you that don't know, is a state of where your cancer is less than 5% of your blood cells. And every single human carries a certain percentage of cancer cells in their body, but it's normal. It doesn't affect your body adversely.
And it doesn't mean you're going to absolutely get cancer.
No, it has no inclination of that.
But if it goes above that percent, that's where the bone marrow biopsy comes in to tell them how much above that percentage it is. Is it 6%? Is it 25%?
Right.
Is it whatever? So that's a very key distinction of why you need an actual bone marrow biopsy.
Yep.
For blood cancers.
Yes. To make sure you're in remission, and if you're not in remission, then you need to take action right away.
Right. So then the question I always got at drives, like registry drives to register bone marrow donors, is, so you have to have a bone marrow biopsy. Is that the same thing as a spinal tap? No, it is not.
No. So just from blood tests, you can tell if the cancer cells have spread anywhere. So for me, they had to do a spinal tap, or it's also called a lumbar puncture.
Yes.
And this is where it's similar to a bone marrow biopsy, but this is where they take fluid. So so for me, the process was I had to kind of curl up in fetal position, and the doctor insert a needle in my back, and they had to puncture the area that's surrounding the spine.
In the lower vertebrae area, right?
In the lower vertebrae area, yeah.
In between the vertebrae is where the needle goes into.
Right. So if you can picture the vertebrae, there's like a little hole. That's pretty much where they had to insert the needle.
And it taps into the canal, the spinal canal.
Right, and then they had to take out spinal fluid. It's also called cerebral spinal fluid,
which is a clear fluid.
It's just clear, and then those samples will tell you if it's spread to my spinal fluid or if it's spreading to like anywhere else in my body.
Right.
So that was done for me right away, because they wanted to know if the cancer had spread, because it was acute, so it was aggressive. And luckily, it didn't spread anywhere else.
I think the spinal tap or the lumbar puncture tests to see if it spread to the brain.
The brain,
That
yeah.
was what they were testing for. That's the
Right.
reason they gave
Yeah.
me the lumbar puncture.
Yeah. Yeah.
So yeah.
And I had to get that done once every 3 months, maybe 2 months.
Oh,
Well,
really?
you
That
had
frequent?
multiple.
Yeah, it was pretty frequent. Yeah.
Oh, wow.
Yeah. Especially in the first maybe quarter of like treatment, I was going in quite often.
Wow.
I think that's probably just to make sure
It's
that-
not
It's
going
not-
anywhere
it's a
else.
precautionary.
Yeah. Especially when you're dealing
precautionary,
with acute
Yep. Yep.
Yeah.
leukemia. Yeah. Yeah, I didn't have any of that because I didn't have, my MDS had not turned into leukemia. So there was no chance of it spreading.
Right.
It was already all over my body only because myelodysplastic syndrome is just literally your blood production. So, but there was no cancer cells that were spreading to my body. So I didn't have any of that. Okay, so those are some of the first things that we dealt with, right? You know, counts. You know, a lot of times people will say, well, what's your counts like? And that's really those ranges of normalcy that you're getting compared to. And then symptomatic stuff like petechiae, that's what we talked about. And then getting diagnosed, all involved, as well as, I guess, throughout treatment, you're getting various either spinal taps and bone marrow biopsies or aspirations, or one or the other. Typically, if it's leukemia, you're getting both. If it's some other kind of blood disorder, you may only get one. I only had bone marrow biopsies. But then, so let's talk about when we actually got into transplant and things that we heard there that were kind of new. Like for me, ports was something I had never dealt with before because I didn't have any treatment before the transplant.
Oh, that's right. Yeah.
What's a port?
So a port, well, Mr. Tongue, a port is a device that's inserted into a vein, and is where the doctors and nurses administer medication, transfusions.
And this is so you don't have to get
Poked
every single
over
time.
and over again.
Yeah, trying to find a vein.
Yeah, so you get a vein, and a lot of times if you get poked over and over again, your veins will collapse just from exhaustion. Like I had that happen at one point, you know, and early on when I was getting, I don't know how many blood tests done a week. So a port gets inserted, and there's people that have other kinds of cancers, I think, that have ports because if they're receiving chemotherapy.
Ports and PICC lines.
PICC lines. So I didn't know there were different kinds.
A Hickman.
There's a Hickman, and then there's a PICC line.
There's probably even more that I don't.
Yeah,
like
maybe.
There's a PICC line.
But
Do you
I
know
know
the
that-
difference.
Yeah.
Okay.
So a PICC line is in your arm.
Okay.
It's in your bicep.
Bicep. Yeah. Okay.
And
There's an artery.
yeah,
Mhm.
they go in through a little, very small incision, but then they just sort of,
It's like a
Comes out of
catheter.
your arm.
it's a
Yeah.
catheter.
It's a catheter
exactly.
that leads from the artery in your
Into
in your
your-
arm to right by
right
your
by
heart.
your heart,
Mhm.
so that your
The main blood.
main source of blood pumping
Will
will
pump
then
the,
put everything,
whatever it is,
if
is in
it's
your body, yeah.
transfusion or chemo or medication,
Yep.
and then the Hickman goes in your chest,
Right.
It's
and
right by the heart.
That's
right
what
by
I
the
had.
heart.
Oh.
And what I had learned in the City of Hope, I guess, Bone Marrow 101 class we did, the Hickmans, they're moving away from those more often now because it sounds like,
Infection.
yeah,
Yeah.
you get more
forgot that.
infections with Hickmans as you do with PICC lines. Now, of course, whatever your doctor is going to recommend is what you should do, but that is something that they were mentioning is it can happen, you know, it can happen with any of these lines. Obviously, you have an open hole in your body, but the PICC lines and the Hickmans are seemingly the two most common devices that people get.
Yeah, I remember I had a Hickman.
You had it in your chest.
Yeah, but it was weird. So I think they found a vein in my neck.
Yeah, your neck. It can go through your neck, actually.
Yeah,
too.
so it started in my neck, came all the way down, and then out right near my armpit.
Oh,
Like
interesting.
right, I saw the scar from both, I think, where they inserted it and then where it came out. And
Yeah.
it was funky.
Yeah. They're weird.
There was an entry point and an exit point.
Yeah, so I think
How's
they
that?
connected it in a vein in my neck somewhere.
I feel like I had heard that some people had
Yeah.
lines inserted into a neck vein.
That's where mine was. And then it came out, like the tubes came out right where my armpit.
Maybe because you were so small. I mean,
and that might have
it
been
has
the
to be
only option too back then.
Yeah, well, and yeah, it could have been the only way they did it. But the guy who did my PICC line was telling me that the size of the veins obviously determines where they
Where they're
can
gonna
go
put
in.
it. That makes
Because
sense, yeah.
my right side is actually, I can never give blood from my right arm. Never.
Because the veins are just.
The veins are just really small. And it's not like I have like lopsided circulation, but it's just the way it is. So I told him, I said, I only give blood out of my left arm. So he went in through my left arm, but he said, and they use like what do you call it? Ultrasound. They use an ultrasound to see where the veins are. At least they do
that's
now.
nice.
So they can see, and you can watch it on the monitor while they're doing it.
there's
Like the size
all-
and the blood flow, or just like the size?
You can
of
see the
vein?
size of the vein, and so he was looking at, it's like when pregnant women get their ultrasound, right? It's that jelly, and then they're looking around, and so he was showing me on the screen. He's like, okay, see that sort of squiggle? He's like, that's the vein we're gonna go in,
Oh, interesting.
and then they kind of just fish it through.
That was technology beyond.
It's
your,
crazy. Yeah, I mean, it's got to be so different now.
Yeah.
Yeah.
You got like a Polaroid.
Yeah.
There it is.
There it is. We're gonna go right in there, somewhere around there.
We think there's a vein there. We're just
We're gonna
go
feel
for
it around.
You're gonna be put under, so you won't even
Yeah,
feel
don't
it.
worry about it. If we
Yeah.
mess up,
They just
he'll be
slap
asleep.
Yeah.
Go to sleep.
Yep.
Yeah, see, I wasn't asleep when they did mine,
Oh yeah, they put me
so I
out.
was super nervous. I kept asking everyone. I was like, "Does it hurt? Does it hurt? Does it hurt?"
So scary.
It was so scary because you're like, you've never had it input,
Do you
Yeah.
do you remember how long you had the port inside your body for?
Yeah. I had it obviously throughout transplant, and then they had to keep it in for I think a month or two after transplant, just in case something happened.
Yeah.
Yeah, because I remember going in and then outpatient.
Yeah.
Just got
you
it.
have yours.
Just
Yeah.
got it taken out.
Well, and you're going so frequently that they don't want to keep poking you afterwards.
Right.
So it's like easy
Right.
to just be able to do blood draws
Yeah.
from the.
Did
Yeah.
you have to get it cleaned and the gauze changed every week?
Gauze change, yeah. I mean, I was able just to clean it myself. They just gave me that red, I forgot the cleaning solution stuff where you
They
just
gave it
kind
to
of
you?
just
Wow.
wiped around like the opening.
Did they give it to you?
No, I had to
No,
go
we
in
had to go
get
in.
it cleaned
Oh, really?
every week.
Oh yeah.
I mean-
like they scrub it.
Yeah.
Oh,
They
no,
didn't-
they didn't.
It's intense.
They
No, they just gave
disinfected
me-
and everything. It's
Yeah, they just gave
crazy.
me like this. It was like a big Q-tip with like this red.
Huh.
Brandon, it's amazing that you're alive.
This was in 18 what or 19?
1800.
Yeah.
It was like-
I can't believe they sent you home with it. Oh my god.
Yeah,
And a 13-year-old.
and like yeah, my mom would put. We would clean it, and then they gave us like this clear
Yeah.
stuff to like
With
keep
bandage.
it in place.
Yeah.
Yeah, we had to like
Because you can't get it wet.
fold it. Yeah, we had to fold it so it wouldn't like snag, which happened a few times. Right, did it come in and like push it in more?
Oh.
Yeah, that part sucks.
I mean, it sounds horrible. This stuff doesn't actually hurt. Like, at least for me. I did not have any pain. I mean, I had
Discomfort.
It was discomfort when it first got inserted because
Yeah,
it's like an
it's
open wound.
weird.
it's a
just-
psychological
But
thing.
then it is psychological. Then I didn't feel it after that, and
Yeah.
I
But
got
when you
very
have it,
used to
it's
it.
so useful because they don't have to poke you. They just
No,
come
it's
in,
so
they
nice.
just draw the blood.
I
from
know, I'm
right
like,
there.
here you
just-
go.
You just lay there, yeah.
Yeah, so easy.
Yeah.
But no, we got our bandage and would get changed every
Gauze,
week,
Yep.
and they'd have like a clear Band-Aid,
Mhm.
basically a big patch that
Uh-huh.
would like go over the whole thing
Right.
because to keep it from any infection. But she'd scrub it like take everything off, and then so then the PICC line's just hanging out of your arm, and then literally she'd like scrub your arm.
I know they definitely didn't scrub it because that thing got funky.
Oh, oh my god!
man.
Maybe because it was so close to like my arm. Maybe it was just my armpit.
That's
that smelled.
crazy.
Yeah, you had
I
tassels.
cannot believe
Yeah,
you're
tassels.
alive.
Yeah. Yeah.
How long did you have your poured in for? You had a pick,
I
right?
had a pick.
And that's
Uh-huh,
like under the
PICC.
skin, right? So they still have to poke your skin.
No.
It's out.
No, it's out.
Oh.
Yeah.
It's basically
Okay.
when they.
There's literally
it's
it's
two
like an
tassels.
IV that
Uh-huh.
hangs out, and there's two
Tassels,
heads.
like two-
Yeah.
Oh, because I know
two
that there's one
tassels.
too
Two
where
ports,
it's still
openings.
under the skin, so they have to poke it to find it.
That's not a pick. A pick line is always outside. I mean,
Okay.
well, there's a part of the pick that is always outside your arm, and it literally looks like an IV that just is
Okay.
permanently there, or not permanently, semi-permanently. I had mine for 3 or 4 months post transplant. I think I got mine out in like April, and I was so excited to get it out because that means like things are going well, obviously.
Mhm.
And so when they said I could get mine out,
It's a good thing.
it was great, and I made Mark film her taking it out
Yeah.
because I thought it'd be really dramatic and like blood would splurt everywhere
Or
when
like a
she pulled
long
it out.
worm
Yeah,
looking
like just like blood gushing everywhere. She removes the dressing and she's like, "Okay, are you ready?" And I'm like, "Am I gonna feel anything?" She's like, "No." And I said, "Oh, okay." So she takes it. She goes, "Okay, on a count of 3," and she goes 1, 2, 3, and she just takes it out. And I mean, it's a long tube. Very skinny. Didn't feel anything, and no blood came out. I was
like,
so
"Aw."
disappointed. And Mark videotaped the whole thing. He was like, "Wait, that's it?"
That's it?
I was like, "That's so
It's
anticlimactic."
like pulling a worm out of your nose or something.
Yeah. Yeah, it's weird.
See, I wish I had like a camera. Like I would have told my mom to like videotape spinal tap,
Yeah.
like all that stuff, just to see.
Was she in the room? Was she able to be there?
I
wonder, 'cause you were
I
so
want to say like
young.
the first time she was
you
in
were
there.
so young, yeah.
Yeah, but after the first
Then they said,
couple, I was like, I don't really need. Yeah, because
"You're like, I got this."
Yeah.
Wow.
Like it wasn't that bad. It
Wow.
didn't really hurt. It was just a weird pressure. The funkiest part was when they actually entered the spinal, I guess, canal. Like
Yeah.
you felt and heard a pop.
That is so weird.
Yeah.
Yep.
But is that painful?
It wasn't painful.
Just
It was
weird.
just weird.
It's a weird
and
sensation.
like it just feels like a lot of pressure,
Yeah.
but not so much.
like pressure.
Pain.
Yeah, I remember like pressure.
Yeah.
Pressure seems to be something that the medical world talks about. I feel like whenever I was asked if things would hurt, they'd be like, "Well, you're gonna feel pressure."
Yes.
I'm like, "What does that mean? Is that hurt or not?"
Yeah, is that emotional?
Is that is
there's a
that
lot of
physical
pressure.
pain or what?
I do feel a lot of pressure.
Yeah, right? Interesting. Okay, so talking about... Okay, so we talked about PICC lines, ports, Hickmans. So then one of the other things that I think is confusing for people too, or maybe something that is a definition that can be helpful to understand, certainly before treatment, before any kind of transplant, you start hearing a lot of GVH. GVHD, GVH, which basically all stands for graft versus host disease. And do you guys want to talk about GVH?
You know, before we talk about that, can we just dive in quickly? Basic treatment.
Yeah. Oh, yeah. Good
Just like-
idea. Right. Yeah, like steps of treatment and okay.
Because like for me, I only received chemotherapy.
Right.
So when I was first admitted at CHLA, the next day I was on chemotherapy right away.
Do you remember how many days you did?
I don't. Yeah, I don't remember how long. I know I had to go through certain amount of rounds.
Oh, interesting. Okay, yeah.
Yeah, it wasn't like a 7-day thing. I had rounds of chemo.
Oh, okay.
So I was on, the first one was aggressive, and then it gradually got less intense. I guess depending on how if the blast cells were still there.
Right. From what I understand, especially when you have leukemia, especially acute leukemia, you have to go through rounds of chemo to suppress the cancer, right? Before you get to a stage where you can actually qualify to have a transplant.
Right.
So that's why you and Alex went through rounds of chemo.
Yeah.
And people who have AML or ALL or whatever would have to get through certain amount of chemo to get to a position where they're deemed qualified for a transplant, because you have to be at a certain level, I believe.
Yeah, and I'm sorry for the listeners. I don't remember the name of the chemotherapy that I received. I just remember it was orange. Yeah, I remember the bag coming in. It was like bright orange, like Gatorade color.
Yeah. Mine was clear.
Yeah.
Oh, maybe I had an orange one. I don't think so though.
Yeah.
Okay, so you had chemo. You had the spinal taps. I guarantee you had some sort of bone marrow aspiration. You had to have had some kind of. I know you don't remember, but you must have had something.
Unless they knocked me out.
They might have.
For it, but.
Or maybe there was a different way to test it, but yeah.
Yeah.
Okay, so you did chemo. And that prepped you for the transplant.
Right, so I had the rounds of chemo when I was first diagnosed, and then I had another aggressive round of chemo right before my transplant.
Oh, okay.
Because that one had to wipe everything out before I started my transplant.
I think that's protocol for most.
Yeah. And that was the only round of chemo where I got sick. When I was first diagnosed, and then that first round of chemo, I was fine. Like, people came in and they didn't think I was sick because I was like, I didn't feel anything.
Yeah.
I still had my appetite, which was weird. I was gaining weight in the hospital during that time, which was weird. Yeah, just that round right before transplant was
harsh.
Kicked my ass.
Yeah.
Did your hair fall out?
Oh yeah, I remember when it first started to fall out. I had some kind of tape that was taping up my Hickman, and I was like wrapping it around my hand and like peeling it off, like tapping my head and like peeling it off.
Yeah.
It was already coming out, so I'm like, I'm just gonna mess around with this now. So yeah.
Aww.
So weird.
Poor little bald 13-year-old Brandon.
And now I'm a bald 33.
It's all come full circle for you.
Yep.
Well, you should be used to it.
Yeah, man.
Yeah.
No surprise.
Alex, you had a different type of intro to transplant, right?
Yep. I basically got diagnosed with the AML and with the high white blood cell count. So they had to. First step was to put me in remission, which is to lower my white blood cell count, to try to put me in remission.
Right.
So that's why they did the first round of induction chemo, which is the first chemo everybody goes through when you find out you have your
cancer,
diagnosis. Yeah. And it was a very strong 7-day, 7-night, 24-hour drip of.
It was 24 hours.
24 hours.
Wow.
7 days, 7 nights. Then there was cytarabine.
And that's a pretty hard one.
It was called the 7+1 cytarabine something. I don't know. They said it's one.
You felt pretty crappy.
Yeah, they said it's one of the harshest.
I remember hearing that name.
That they give to people because of the severity of it.
Right.
And
is that one called the Red Devil?
I don't know.
Was it red?
It was clear.
Oh.
But the people that administered, the nurses that administered the chemo came in like the toxic
hazmat.
Yeah, I know. Yeah.
Gear
You're like, great. That's going to be
that would have freaked
awesome.
me out.
Yeah. They're like, oh, this is radioactive.
Yeah.
You're like, sweet.
It was pretty trippy.
Yeah.
But yeah, and then I didn't know I needed a bone marrow transplant yet at that time. They just wanted to put me in remission, and I thought I just, I I had no idea what a bone marrow was at
Right.
that time.
Yeah.
I just newly learned leukemia, AML, and that's it. White blood cell, red blood cell, platelets.
Right.
So yeah, that put me in remission, luckily, and then that's when they identified all the different types of cancer cells, as far as for leukemia, and there's tons of different types of leukemic, myeloid, immature
Right.
cancer cells that could exist in your body. There are ones that are not so aggressive, and then there are ones that are super aggressive. Like if you don't get rid of it, you're gonna die. And I had one of those. It was called the FLT3, and then that's when they said, do you have like a 6-month window, and you need to have the bone marrow biopsy, bone marrow transplant in order to get rid of it.
Wow.
And then that's when it all started. That's when I went to City of Hope. I started at Los Alamitos, where they have
That's
a
right.
great hematology,
Oncology
department. And shout out to the doctors and nurses there. They were amazing.
So you got your first round of chemo administered at Los Alamitos.
Yep.
Oh, okay.
Yep.
And then when they said, you know what, you're going to need a transplant,
Yep.
that's when you got sent to
When they
City
found
of
out you
Hope.
had that FLT3, that's when
Yep,
they sent
and
you
then
to.
that-
Is that a chromosome?
No,
thing?
it's
Or it's just a type
it's
of-
a type of immature cell,
Oh, interesting.
cancer cell. Yep.
Okay.
So, yeah, and then that's how I ended up at
But then you had, in terms of preparation for transplant, you had, different than Brandon, you and I had radiation combination.
yeah,
with
and
chemo.
and what you were mentioning earlier, I could have had my transplant right away after my induction chemo if I had a match, because I just needed to be in remission, and then I could have my
Right.
transplant.
But you didn't have a match
I
at
didn't
that
have a
point.
match.
Yeah.
So the 6 month that dragged along before I had or 7 months before I had my transplant was due to the fact I didn't have a match.
Right.
And I was searching.
Yeah.
And I ended up with the clinical trial
Right.
of the cord blood, using a baby's blood, baby stem cell,
Yeah.
or stem cell from a baby to transplant. And it was a close enough match.
Right.
But what were you asking me? Oh, yeah, and I had radiation.
Right.
It was 6 rounds of chemo once every month, and that was to suppress the cancer to keep me in remission.
Yes.
And then when I had my transplant date set, which was January 23rd, they prepped me with like you said, the chemo before, which is aggressive
Yeah.
chemotherapy that they administer before your transplant, along with 3 or 4 days of total body irradiation, which is the same as getting radiation, but
Yeah.
it's
But it's a full body.
it's a full body. Yeah, think of it as a full body radiation, except they cover your, they cover
Lungs.
your lungs, your vital organs, basically.
No, they only covered my lungs.
Or I don't know. They gave me this clear thick plexiglass plate to cover like my groin area.
Oh,
and
your prostate probably is what they had to cover.
I don't know, but yeah. Anyways, it's total body irradiation, TBI, and it was like an 8-day countdown.
Yep.
It's like an 8-day countdown, and then they set like chemo this day, radiation this day, both on this day, and then countdown 3, 5, 4, 3, 2, 1, and then
Transplant.
transplant day.
Can you talk about the process of radiation, like what you get to do while you're going through it, and like what it
Yeah.
felt like?
Yeah.
Yeah,
So-
I posted a video of it on my Instagram page. So yeah, it's
Give your Instagram so people can look at it.
it's kind of
it's
hard.
kinda
Oh, you can look
complicated.
up Alex Tung.
Yeah.
But yeah, or hemopoietic. Yeah, hematopoietic. There you go. It's another name for bone marrow transplant. But
Total body irradiation is a so typically it's twice a day. So you have a morning session and an afternoon session. Depending on your illness, depending on the stage of your illness, the severity, your body, everything that, I mean, there's a lot that they look into. They determine the number of minutes every session you have is. So like I had 13 minutes twice a day. Alex had different amount of minutes. I think you had a little bit, slightly longer than I did. And probably that's because due to the severity of Alex's disease versus mine. So, and the difference of our diseases.
Right.
So you go, the prep for total body radiation, and there's a lot of people that have cancer, all forms of cancer can be treated with radiation, but there's very targeted radiation. So like breast cancer, I know a lot of women who have had breast cancer, they've had radiation, but it's highly targeted.
Makes
so
sense.
like a laser beam target. Same thing with prostate cancer.
Or tumors.
Or
on the body.
tumors,
Yep.
yes, absolutely. So it can be very, very targeted in
Specific
terms of how
part of the
they
body.
administer it. The type of radiation that Alex and I received is, as we said, total body. So it's literally from your head to your toes. So you get fitted prior to your sessions. You get fitted for specifically whatever they need to cover so that those parts of your body does not receive radiation. So like my lungs, I had plates, I had a chest x-ray of which they looked at my lungs and then designed a metal outplate or a metal shape, put that in front of me so that when I stood there, and you're standing, so you get put in this harness so that you don't move. You have things you can hold on to, and there are these plexiglass
You're in between these
these two massive
plexiglass
kind of like movable walls, right? But they're clear, you can see through them.
Right.
And the room, there's a massive machine that
a giant
like,
radiation
yeah, like
machine
if you've
that
seen, if you,
beams
yeah,
invisible
Yeah.
radiation rays at you.
that shoots radiation at you.
It's
So
super loud.
If you think of like an MRI exam, like a machine for MRI, I mean, I'm
Like
talking
that banging noise.
size of that and noise of that level
Uh-huh.
is what this thing is. But it's a good 20 feet away from you. So you stand there, and everyone exits, and they turn on the machine, and it shoots radiation at you. You don't feel anything. You don't, at the time. You don't feel, it's not like you're like, oh my God, I'm getting fried, you know? Like
Like you don't feel like
you don't feel any,
It's
there's
invisible.
nothing.
Whatever.
There's nothing physically that you can feel in the actual process.
So was it weird at the time, like the first time you did it, like is it doing
Well, I
anything
kept
or
texting Alex. I'm like, what am I supposed to expect? And
Yeah.
he's like, it's really rough. I'm like, oh my God, okay. But I didn't know. And he was explaining to me, he's like, look, you're going to feel really tired and afterwards. And like, he's like, it doesn't hurt though. Don't worry. And it doesn't. But the physical reaction you have post session, it varies for sure between patients. I felt always incredibly nauseous. I would get really white, sweaty. I'd have to sit down for a while. Like right when the radiology team comes back in and they unhook you from this harness, I would feel really weak. And you sort of have that, like you have the flu, kind of.
Yeah.
Would you describe it like that? It's kind of like you
it
feel just
totally
really
drains you.
crappy.
yeah.
Yeah.
Because you're just getting shot up with.
Yeah, and those the whatever longs your minutes are. I mean, I literally, the first time I went, I was like, oh my God, 13 minutes? That's like nothing. Okay, cool, whatever. It was the longest 13 minutes of my life.
But you have to stand there
and not move.
Yeah, that would be the
And
hard
you
part.
feel very claustrophobic because you're
Yes.
put in between these two plexiglass screens, and it's just it's more the sensations you have during and after. It's like you feel claustrophobic, you feel nauseous, you feel sweaty and flushed, and then it kind of passes, and then you go and do it again, and then it passes after that.
I felt like a fried fish. They had to flip you.
They flip you.
Oh, they just
You
like
do
turn you in the
one,
glass.
so that's
One
the two
side.
sessions.
Uh-huh.
Morning session, you're facing one way. Second session, afternoon session, you're facing the other way.
Gotcha.
So they've got to get your whole body.
Right.
So when you're done, you're fried.
Yeah.
Literally.
Just
Literally fried, yeah. But you don't. But a lot of times, actually, they do say, people feel they get a skin reaction like you've been in the sun.
That makes sense. Yeah.
So like Alex, you had that skin. You got really dark.
I got really dark.
Really
yeah.
dark. I did not. I didn't get dark at all. I was hoping. I was like,
easily.
can I get tan? But I didn't have that. I threw up a couple times. That was actually for me so my induction chemo was called fludarabine, and it's a chemo they give to a lot of cancer patients now. And I was like asking the doctor, I'm like, so am I gonna feel sick? Like, am I gonna? She's like, actually, this is a really tolerable chemo. She's like, there's people that have cancer that get this chemo and they go to work the same day.
Oh, wow.
Oh, wow. So I got mine, and it was a long drip, but it wasn't 24 hours. It was, I think we were there from I don't know. It's just slow because they want to see how you're reacting. So it was at least 5 hours. And I remember the first night I got home, my 3 best girlfriends came over to see how I was doing. And I was like, I don't know, I feel fine. They're like, really? I'm like, yeah, I don't know. I feel fine. And so I didn't get sick from that. I didn't feel nauseous. I didn't have any loss of appetite.
Yeah.
I was hoping I was going to get really skinny, and it didn't happen.
I think people have a preconceived notion
Totally.
of what
Because
chemo
Because what you see.
well, and
radiation
there
does.
are various now.
Mm-hmm.
There's so many different kinds, and I didn't know that. I didn't know there were so many different kinds until I actually had to get one.
There's even chemo that are just orally
Oral.
taken
Orally,
pills.
yeah.
pills.
Yeah.
Or they go in once a week and get like a 1 hour injection.
Yeah.
Yep.
Yeah.
Like almost like a micro dosing
Yeah.
of chemo.
That's like,
to-
for
to-
those
to
chronic
maintain,
ones.
yep.
Yeah. So, and then I remember, I did the chemo for 3 days prior. Then I did 4 days of radiation twice a day. Then I got the transplant. And then they gave me the weekend to see how the donor cells would react to my body. And then they hit me with 2 more days of a much more intense chemotherapy, which I did feel sick. I was throwing up a lot for that.
Yeah.
But it was only 2 days worth.
Mm-hmm.
I was lucky I didn't have any kind of pain. But yeah, that was definitely, that was like Alex and I had a more similar process. And they do this regimen. I think this is, I know it started at Johns Hopkins, and then City of Hope is doing it, and they're trying to make it their standard of practice, standard of care. Because I'm a research patient, so they put me on research so that they could have patients that go through this regimen to see if it works and works well, and then that would become sort of the norm of how they treat. So, but yeah, that was our experience.
I wonder why I didn't need radiation.
They didn't used to do radiation.
Okay.
So the old way of doing transplant, like when I was first diagnosed, they told me you're gonna have 10 days of high intensity chemo and then you'll get your transplant. So there was no mention of radiation. So when I went back 10 years later for the actual transplant, they're like, okay, we've changed it since the last time we talked about this.
Okay.
And now you're going to have radiation. So I had to meet with the radiology team. So it's different.
So it wasn't even an option then when I
Well,
was.
I think, I think it was just, I think medicine is always evolving, and science and ways that hospitals treat. Like, again, this was a Johns Hopkins protocol that City of Hope was trying to adopt because they were seeing really good results from it. And so that's where they were introducing the radiation combo with chemo. So I think it was, there's a lot of people that went through transplants, 5 years ago even, that didn't have radiation.
Yeah, no, even till this day, I think it's a case by case.
Right. Yeah.
Like
Just the severity of
people who are like older, may not be able to tolerate
That makes sense. Yeah.
the radiation. So, the doctors have to weigh out the options, what's better for the patient.
The overall well-being.
Or the overall well-being.
Yeah.
So me being, at the age that I was and the health condition that I was, they wanted to give me the full-on everything to get rid of, whatever was in my body.
In really good shape and health.
Right. So they would treat me different than like somebody who was in their 70s.
Right.
Who got
that makes sense. Yeah.
AML.
That makes a lot of sense.
So
every patient is different. So it's really as common of treatments there are, like as the commonalities we all share. I mean, they really, any good doctor and hospital is really looking at the individual patient and figuring out, okay, what is going to be the best for this person.
Yep.
I know what happened with my last patient, and that was great for my last patient, but it might not be what this patient needs. So yeah, even though we all have these common things, there's still a lot of highly individualized, treatment. Basically.
Yeah, there's not just one treatment for one person or one procedure.
Right.
It's a different for everybody.
Yeah.
Okay, so that we covered kind of process of treatment or start of treatment. So then during treatment, we could talk about a couple of things that we got to know very well, like GVH and engraftment, immunosuppression, and maybe we can talk about pain management. So like GVH, like I said, graft versus host is a term, you
Common
hear
term.
a lot.
Yeah.
And graft is the donor cells, typically, and versus host, which is you're the host. So it's their way of seeing how donor cells are reacting within your own body, and
how you're accepting those.
And how you're accepting it. And engraftment is acceptance of donor cells, but GVHD, which is graft versus host disease, can kind of come in various forms. And do you guys want to talk about your experience with that?
Yeah. For me, I remember a lot of discoloration was a big sign of GVHD for me. It was called vitiligo.
Oh.
It's, for those who don't know, it's like we call it the Michael Jackson disease. You know how Michael Jackson...
Discoloration of your skin, right?
Yeah. But
I've
he
never heard of
actually
that.
induced vitiligo. He took pills to lighten his skin.
Okay.
But it's pretty much like
Is it a lightning?
a lightening of
Oh.
your pigmentation.
Oh.
So I had it, you could kind of see it like around like my fingers,
Oh yeah.
and then I had it like around my lips. Those were the main signs of GVHD, the pigmentation, discoloration, and crap, there was one more that I had. It wasn't.
Stomach? Skin? Eyes?
I had sores.
Mouth sores?
Yeah, mouth sores
Yeah.
afterwards.
Yeah.
Those were the two main ones that I had. Yeah, I remember having to take like this medication where I had to like swish it around my mouth to coat it to kind of, I guess, maintain the GVH in my mouth. And then they gave me like ointment to put like on my hands and mouth to kind of blend in the colors. But other than that, I didn't really have too many complications.
Because you had a 10 out of 10 match.
Right.
Yeah.
Yeah.
Which is bizarre.
Yeah.
That it was your mom.
Yeah.
We'll get to that in another episode. The freak that Brandon is super
we need
super DNA freak.
we
that
need
he-
Yeah, maybe the next episode.
we need to have a medical doctor for that one.
Yeah, maybe the next episode will
Maybe 2 episodes.
Yeah.
we'll have my mom in.
Yeah, that would be awesome.
Yeah.
Yeah. I got very lucky. So they were telling me there's acute GVH and there's chronic GVH. And acute is, like we've been saying, acute is aggressive. Anything acute is not necessarily a good thing. the acute that they were looking for is basically any rejection. Fevers, skin rash, sores. I had very mild skin rash in the hospital. I didn't have any fevers, which I was very lucky. And then post, I had stomach issues. So there can be GVH in the stomach. There can be GVH anywhere. I'm learning right now. I have this, I've got this respiratory issue where the next appointment I go to, we're going to do a pulmonary test to see if it's like potentially just to rule out if there's GVH of the lungs. Acute GVH can be deadly for a transplant patient in the very beginning because it can be very severe, and it can be a total rejection. Your body can reject the donors. And then there's chronic, which is sort of like you live with. And I've met a lot of post-transplant patients who have chronic GVH, whether it's various skin rashes, issues, stomach, eyes, various things of where basically your immune system is kind of always reacting to the donor. But I've been lucky where I think I've had very minimal GVH. I really haven't had much issue. Alex, did you have any GVH?
I definitely had GVH right after my transplant, and it wasn't like Brandon. I didn't really have any skin issues. It was mostly internal, lungs, kidneys, intestine, stomach.
Yeah, stomach is pretty common.
Yeah, well, your stomach is the largest organ in your body, so.
Yeah, now that I think of it, I
Skin
did
and
have
stomach.
it first in my stomach because I would have diarrhea a lot.
Well, and that
right
happens,
afterwards.
and that happens from chemotherapy.
Chemotherapy too, yeah.
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 But stomach and skin are the two most common, I think, because those are the biggest
organs.
organs
yeah.
in your body.
Yeah, no, I had a pretty clean engraftment, which means the new stem cells from the baby assimilated with my body pretty smoothly. I didn't have too dramatic of a case of GVHD, and it seems like the baby cells likes the environment that it's in.
Well, how could they not?
Yeah, I mean, I try to keep it very, very peaceful and harmonic
Welcoming
inside. Yeah,
and
warm
welcoming,
and
yeah.
nurturing.
Cozy.
And yeah, luckily, there was a little bit of growing pains inside me with GVH, but nothing too severe, luckily. And that's what it was explained to me when the doctor gave me the option of the cord blood versus an adult
donor.
Because you would have less complications.
Yeah,
right?
they said with a cord blood transplant, usually you have less GVH afterwards for the rest of your life versus other, and I can give my own testimony that does seem like that's the case.
Been the case for you.
Yeah, so yeah, very fortunate. I think all three of us have been very fortunate.
We have.
Like, when I first got to City of Hope, and I was there for like 4 or 5 months, and I was always, going in for various reasons, and I would see other transplant survivors who had extreme GVHD, all over their skin and internal organs, and and they're like 5-10 years out. Some are 1 to 2 years, and some are like 5 to 10 years, or and they have and that scared me. I was like,
it is scary
because you don't know what's gonna happen to you. What
No.
if you have like this chronic case of GVHD that you have to take meds for the rest of your life just to suppress it,
Right.
And that's very common for people.
Do you guys at City of Hope ever have to go to the 1C and see the GVH specialist?
No,
Yeah, I used to.
I don't have to.
I used to.
That's the only doctor I see. They specialize
really?
in GVH. Yeah.
You still have to go to them?
Yeah, that's the only
Just
doctor
to
I see.
monitor it, basically?
Yeah.
Oh, interesting. I don't know.
Yeah. So
I
they
don't.
they look at like inside my mouth. They look at like my armpits, just see if anything
Anything
new
is
shows up. Yeah.
happening. Interesting.
But I had all of that too, right after my transplant. The
Yeah.
mouth sores,
Mhm.
the just everything, the lungs and the
Yeah.
because basically it's all the organs in your body are you know, potential to be affected
Yeah.
by
Oh,
GVH.
yeah.
Like,
Absolutely.
Anywhere. It could happen anywhere in your body.
Well,
Like
I
your
was
eye-
most scared of the acute because that acute stuff happens in the first year
Mhm.
post-transplant.
right.
And and that's really the time where if it's going to get bad, I mean, your potential of not surviving it can
It's
be
within-
high,
yeah.
you know, and that was what was really scary for me and worrying was, you know, any kind of potential issue. I remember I had to go back in the hospital for stomach issues, and I was really worried. I was like, oh God. And it was like 2 months after transplant, and I was thinking, oh my gosh, this is where it's starting, you know. But fortunately, it was not that. It was actually I ate Japanese curry, and it was too spicy. The gastroenterologist was like, no, you're fine.
Yeah, that's
Stop
one question
eating
the doctor
spicy
always
food.
asks me. Like, they always ask me, "Do you have stomach problems? Can you eat spicy foods?" I'm like, "Yeah." They're like, "All right." That's
Yeah.
one question they always ask me for some reason.
Yeah, because it's your stomach gets pretty stripped, and then you know that can be where a lot of the common
Yeah.
GVH is, and you know, but
Yeah, I had GVH in the gut for like over a year.
oof,
But for me, I think it's hard to tell for me, too, if I did, because I always had stomach issues, even when I was younger.
yeah,
So,
and
like,
you just
having, like,
keep
diarrhea all the
eating
time.
spicy food.
yeah, I love spicy food. I don't learn. I just deal with it.
That's like my brother. It's the same way. Like, stop eating that, and you won't be on the toilet for 6 hours in the day.
That sucks.
Yeah,
Yeah.
Yeah.
but yeah,
That's
yeah.
no bueno.
I know. Are there any other terms that you guys feel like
You know-
kept coming up for you that was,
What medication did you take afterwards?
oh my God, I can't go through the list.
Did
Too
you have
much.
to take cyclosporin?
No,
I did.
Yeah, you had cyclosporin.
I-
Cyclosporin and Bactrim were the only two that
I had.
I can remember because I had to take those forever.
I took cyclosporin in the very beginning,
Uh-huh.
but
I think
it
that's
didn't
a
do
common
anything for me.
medication for any kind of transplant, I think, because it's an
Well, it's chemo
think it's-
based though.
cyclosporin is?
Mm-hmm.
It's a what?
It's chemo based.
Oh, is it?
At least that's what they told me.
Oh, I didn't know that. I just remember.
Well,
the
that
other-
would make sense because if it's an immunosuppression, chemo is
It's a yeah.
an immunosuppression.
Mhm,
So
that
the
makes
drug
sense.
that you're
Yeah.
taking post-transplant, there's a lot of immunosuppressants.
Mhm.
Where
It
there's
suppresses your
suppressing your own
your
immune
original
system. Yeah, yeah.
immune system,
so
your
that
white
your
blood
donor
cells.
cells have a chance to grow.
That makes sense, yeah.
So
Yeah.
there's not as much graft
Yeah.
versus
I
host.
Yeah.
just remember those stupid pills. They smelled like fucking skunk.
Oh,
Yeah.
I did.
Like, so whenever I smell skunk, it just reminds me of those little gray, blue
Huh.
pills that I had to take all the fucking time.
Yeah. You know what kind of pills I got when I was in the hospital? I got a Marinol,
What's
What's
that?
which is a hospital grade marijuana pills.
No way.
Yeah,
Oh.
it's the little
They
these
gave you
little
that?
little green pills. Yeah, all the hospitals. If you just ask for it, they offer it.
Oh, I didn't.
But
get that.
after taking it, it's very very low dose. You
But
don't
it's for
really-
pain, right? Is that for pain?
It's for an array of symptoms
Oh.
for different reasons.
Uh-huh.
But they do have these little green pills called Marinol. So
That's so funny.
it's pretty.
That was one
cool.
of the questions I
don't
posted
think-
on Instagram.
I don't think
Do you guys
they
have
had
any
that.
terms or like information you guys want us to talk about? And like medical marijuana was one of them. If you, I didn't take it.
Yeah.
That was
They did
No,
not
I don't
give
think
me
they
that
had.
option.
They didn't have Marinol back
yeah,
when.
yeah.
My
yeah.
doctor wasn't into that kind of.
No,
Yeah, I
my
guess it's-
my doctor wasn't into it either. But you can request it.
But you can request it. Nevertheless, you can request it.
So
Yeah,
there you
no,
go. If anyone's going through it, request.
That was one of the first
Alex.
things I asked. When
What's
I,
it called?
when I got
Marinol?
diagnosed. Marinol.
There you go. So if anyone out there is going through
Maranol.
treatment, ask your
Yeah,
doctor
go ahead
for
and ask for that.
referral.
Yeah.
According to Dr. Alex.
Yeah. Dr. Alex.
Dr. Chen. Dr. Chen.
Dr. Green Thumb.
But that could
I-
be another topic, another episode.
Medications?
Yeah, medication or like medical marijuana and CBD and
Oh,
all
yeah.
that stuff.
That we could, yeah.
Yeah, that, I think that goes along with like holistic treatments, and I believe holistic and medical scientific treatments go
Mhm.
hand in hand.
Yeah, you can combine.
Yeah.
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 Yeah, there's definitely ways of going the natural way of your body to try to
Yeah.
combat this
Yeah.
terrible.
Mhm.
There's a lot of trial and error with some of that. Just have to figure out what works.
Yeah, but terminology wise, man, there's like
There's a lot.
There's
there's
a
a
lot.
lot. I think we
Just the
we
main
barely
takeaway,
like,
I
yeah.
think, is if you have questions or you don't understand something, you should ask your doctor, because a lot of times doctors and nurses and people who live it day to day think, well, of course you know that.
You know what
means,
this
you
is,
know?
yeah.
So don't ever hesitate to ask, because you didn't go to med school.
Yeah, and what you said
You know?
earlier in the beginning, like having someone go with you.
Yeah, having
To
someone
have
go with you
another
to
set
just
of ears and brain.
And
to,
a lot of times, those people, most of the questions that got asked in my appointments leading up to transplant were always from Mark or my brother or my aunt. You know, like it was rarely me asking the questions.
Right.
It was everyone else saying, "Okay, wait. What does that mean? Or what percentage of do you think this is going to happen? Or blah blah blah." So I feel as though having someone else to help you ask those questions it takes the pressure off of you, because a lot of times you're like, oh my god, what is going to happen to me?
Yeah.
You get in your own little world, so I
Yep.
definitely agree with that.
My mom didn't understand any of the terminology very much, and she still doesn't till this day. And I didn't very much either, because these medical terminology was just way over my head when I first got diagnosed. So when I got to City of Hope and I met my doctors there, I really didn't even try to learn any of the terminology or the medications. I just put all my faith in my doctor. And my doctors gave me that feeling
Right.
to be able to give.
Trust them.
Yeah. And I think that's very important, to find a doctor, because I hear this a lot from new patients, old patients, or caregivers about, the person that's getting cared. They don't like the doctors, or they don't get along with them, or
You should
I-
always
huge,
feel like you
yeah.
have a care
Yeah.
team that is like in your corner.
right.
Yeah.
I
No,
never felt otherwise.
Yeah, no, I had 100%, 110%
Me too.
trusted faith in
yeah.
my doctor, and
Yeah.
I didn't even try to.
Whatever my
especially,
doctor
yeah.
said, I was like, okay, I
Yeah.
gotcha.
So that's very important.
Yeah, absolutely.
Not everybody has
absolutely.
that. And City of Hope has just,
Amazing.
Yeah, so don't be afraid to
unreal.
switch hospitals or
No,
doctors.
if you don't like someone, you should be changing that.
Yeah.
So you have to be your own advocate, for sure.
Yep.
Yeah.
Nobody can stop you from getting a second opinion, or
No.
going somewhere else, or gravitating to a doctor or a hospital that you're comfortable with.
Absolutely. I definitely liked knowing everything, like knowing terminology, medications. What does that do? What's this gonna do? What's that for? To the point where I had nurses coming in and I would say stuff and they're like, were you a nurse? I'm like, no, but I'm really good.
You are really good.
I know my stuff. They're like, wow. But yeah.
Yeah, different strokes for different
Exactly.
folks.
Whatever works for you is what you got to stick with, right?
Yeah.
Yeah.
That's right.
All right.
Yeah.
So,
And before we end too, I want to thank everyone that's been listening. We've
Oh
got
my
like
gosh.
a lot
Yeah.
of like
So exciting.
a lot of good feedback.
Well, and we did this episode based on someone's feedback
Yeah.
and requests. So if there
Mhm.
are things like that people want to hear,
Any topics, anything.
yeah, we're open.
Yeah,
We'd love
definitely.
it. It's so great.
Yeah. So keep
Good
'em-
call.
Yeah.
Way to thank our listeners.
Yeah, I'm
like
always
saying that.
Yeah.
I'm always thinking about our podcast, and I just I come back to just being how grateful and thankful I am to be here,
Yeah.
Mhm.
to be alive, to sit here with
Share
you
this
guys,
information.
share it, and
Totally.
and and to have people actually listen. And
It's amazing.
Like in the clips I just posted of us, we said like, this experience is like bittersweet. It sucks going through, but now helping people, like,
Yeah.
we wouldn't have done this if we haven't gone through it.
100%.
yeah,
So-
Yeah.
I like the quote that Krissy gave one time.
What
Like-
did I say?
I think you said
Quoting me?
it's the club nobody wants to join or
Oh.
something. Yeah.
Yeah, but
It's
it's
the
a
club no
club.
one wants to be in.
Yeah, something
Yeah.
like that.
Yeah,
I think
it is.
But
that's
we're
what
in
it
it.
is, being
Club you don't ask to join, but once you're in it, it's like, all right.
yeah.
I'll find that clip and I'll make a little snippet for you.
Cool.
Sweet.
All right.
Is that it?
Yeah.